Low blood pressure, also known as hypotension, is a condition where the pressure of blood flowing through your arteries is lower than what's considered normal. Your blood pressure is the force exerted by circulating blood against the walls of your arteries. It's typically recorded as two numbers. The systolic pressure, or the higher number, measures the pressure in your arteries when your heart beats, and the diastolic pressure, or the lower number, measures the pressure in your arteries between beats. A normal blood pressure reading is generally considered to be below 120 over 80 millimeters of mercury and above 90 over 60 millimeters of mercury for adults. Low blood pressure is typically defined as a blood pressure reading of 90 over 60 millimeters of mercury or lower. However, what's considered low blood pressure can vary from person to person. Some individuals may have a blood pressure that's lower than normal, but experience no symptoms or problems. For others, even a slight drop in blood pressure can cause symptoms. While high blood pressure often gets more attention due to its association with serious health risks, low blood pressure can also be a significant health concern, particularly when it causes noticeable symptoms or is a sign of an underlying health problem. Symptoms of hypotension. The symptoms of hypotension can vary from person to person and depend on how low the blood pressure drops. Some people with chronically low blood pressure may not experience any symptoms at all. However, when symptoms do occur, they can be quite noticeable. Dizziness and lightheadedness are among the most common symptoms of hypotension. You might feel like the room is spinning or that you're about to faint. This sensation is often most pronounced when you stand up quickly from a sitting or lying position, which is characteristic of a type of hypertension called orthostatic hypotension. Fainting can also occur if blood pressure drops severely. This happens because your brain isn't getting enough blood flow. Before actually fainting, you might experience other symptoms like nausea, feeling warm, a ringing in your ears, or tunnel vision. Fatigue and weakness are common with hypotension. You might feel unusually tired, lacking energy to perform everyday tasks. This fatigue can be constant or may come on suddenly, especially after meals or when standing for long periods. In some cases, people with hypotension might experience confusion or trouble concentrating. This is because the brain isn't getting enough blood flow, which can affect cognitive function. Feeling cold or clammy is another possible symptom. When your blood pressure is low, blood flow to your skin and extremities may be reduced, making you feel cold. Your skin might also feel clammy or sweaty. Rapid, shallow breathing can also occur as your body tries to compensate for the low blood pressure by increasing oxygen intake. You might feel like you can't catch your breath, or that you're breathing faster than normal. Other symptoms of low blood pressure can include blurred or dim vision and nausea. Causes of hypotension. The causes of hypotension are diverse and can range from temporary conditions to more serious underlying health issues. Number 1. Temporary conditions. Sudden drops in blood pressure can occur due to various reasons. Standing up quickly, a phenomenon known as orthostatic or postural hypotension, is particularly common in older adults. When you stand up suddenly from a sitting or lying position, gravity causes blood to pool in your legs, leading to a temporary drop in blood pressure. This happens because the body struggles to adjust blood flow to the upper body quickly enough. Another situation that can lead to a sudden drop in blood pressure is after eating a meal, referred to as postprandial hypotension. After eating, blood flow increases to the digestive tract to aid in digestion, which can cause a drop in blood pressure elsewhere in the body. Emotional stress or shock can trigger a vasovagal response, leading to a sudden drop in blood pressure and sometimes fainting. Prolonged standing can also cause blood to pool in the legs, reducing blood return to the heart and leading to a drop in blood pressure, which is known as neurally mediated hypotension. Dehydration is also a very common cause, especially in hot weather or during intense physical activity when you lose a lot of fluids through sweating. Number 2. Medical conditions. Conditions such as extremely low heart rate, heart valve problems, heart attack, and heart failure can prevent your body from circulating enough blood, leading to a drop in blood pressure. Endocrine problems are another potential cause. An underactive thyroid, or hypothyroidism, can very easily lead to low blood pressure. Severe infections, especially when they lead to septic shock, can also cause a dangerous drop in blood pressure. This is a medical emergency that requires immediate treatment. Finally, we have nutritional deficiencies, particularly lack of vitamin B12 and folic acid can lead to anemia, which in turn can cause low blood pressure. Pregnancy is another condition that can cause blood pressure to drop, especially during the first 24 weeks. Number 3. Medications. Certain medications can cause hypotension as a side effect. These include diuretics, which help your body get rid of sodium and water, alpha blockers, used to treat high blood pressure, beta blockers, used for heart conditions, drugs for Parkinson's disease, certain types of antidepressants, and erectile dysfunction drugs, among others. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of hypotension. To diagnose hypotension, your doctor will start by asking about your symptoms, when they occur, and any factors that seem to trigger them. During the physical exam, your blood pressure will be measured. This might be done while you're lying down, sitting, and standing to check for orthostatic hypotension. Your doctor will also check your pulse and might listen to your heart and lungs. Blood tests may be ordered to check for anemia, blood sugar levels, and to assess kidney and thyroid function. These can help identify potential underlying causes of hypotension. An electrocardiogram might be performed to check your heart's electrical activity and rule out any heart problems that could be causing your symptoms. In some cases, more specialized tests might be necessary. Echocardiograms or stress tests might be used to evaluate heart function if a cardiac cause is suspected. For those with recurrent fainting episodes, your doctor might recommend wearing a Holter monitor, a portable device that continuously records your heart's activity for 24 to 48 hours. Treatment for hypotension. In many cases, especially if the hypotension is mild and not causing significant symptoms, treatment may not be necessary. However, when treatment is needed, there are several approaches that can be taken. For dehydration-related hypotension, your doctor may recommend drinking more water throughout the day and adding a bit more salt to your diet, as salt helps your body retain fluid. In severe cases, intravenous fluids might be necessary. If medications are causing your low blood pressure, your doctor might adjust your dosage or switch you to a different drug. For orthostatic hypotension, you may need to wear compression stockings. These tight stockings help prevent blood from pooling in your legs, promoting better circulation. You also need to stand up slowly from a sitting or lying position and to avoid standing still for long periods. In some cases, medications may be prescribed to treat hypotension. Fludrocortisone is a medication that helps increase blood volume and raise blood pressure. Midodrine is another medication that works by constricting blood vessels to increase blood pressure. These medications are typically used for more severe or persistent cases of hypotension. Also, if an underlying health condition is causing your hypotension, treating that condition is crucial. For example, if hypothyroidism is the cause, thyroid hormone replacement therapy can help normalize blood pressure. Lifestyle changes can also play a significant role in managing hypotension. Eating smaller, more frequent meals can help prevent postprandial hypotension. Limiting alcohol intake is important, as alcohol can lower blood pressure. Finally, regular, moderate exercise can help improve circulation and blood pressure regulation. Now, we want to hear from you. Do you or someone you know have hypotension? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.